Assalamualaikum and good day everyone. We are from Group 7. We'll explain the Euris Group company, the hybrid cloud dedicated to the healthcare sector. My name is Muhammad Syazwan and I will explain what is Euris Group. Euris Group is a French group dedicated to connected health with trusted third party and support a life science with the implementation of the e-health project through digital SaaS software and multi-territory cloud health data hosting solution. Euris is established with Amazon Web Service to store, process, transmit and securely analyze personal health data, and partnership with Roland Berger, a data-driven strategy focused on customer experience, healthcare professional and patient is a great opportunity for the life science industry. We continue to the next part, which is application by Ruven.
I want to present about the application. The first application is healthcare contact and personal contact. The interconnected system will provide useful contact to connect the customer with patient. Rather than that, it is also help to monitor patient treatment goals and organize the scheduled meetings with doctors. It is also act as a storage to store the notes and history of use cases, which might be helpful in conducting specialized treatment and research and development in medical industry. Then, the medication is also important to make sure that accurate and complete notes ensure the systematic documentation of patients' medical histories, treatment, and care. Lastly, the diagnosis, which might help doctor to make diagnosis of patient, whereby using the system, the doctor able to determine the nature of disease or disorder from other possible conditions. How is this system works? Okay, basically, the figure shows the infrastructure of different medical institutions, which is first aid center, medical ward that uses cloud in order to share and process the data. Basically, this system begins with the user interface, then local network, then grid gateway, and lastly, the data is stored in the cloud. It uses smart grid gateway to send data to the cloud, and authorized person can access the detail through the interface. The main function of gateway is firstly to manage access to the cloud, then verifying health record that provided by the healthcare provider, then to control the data whether to share with public cloud or not for further research and developments. Typically, the cloud consists of array of layer elements starting at most basic layers of storage and server infrastructure and working up to application and communication layer. Firstly, IaaS is used for medical data processing and storage. SaaS is used in healthcare service-based applications. PaaS is used for updating the online healthcare. Normally, it is done by software developers. Okay, let's take an example of patient A. Since the patient A is admitted to the hospital, the detail of the patient A is keyed into the interface by a client. By using the local network, the data of the patients will be sent by using grid gateway. Then the data is stored in the cloud. For example, the data of CT scan or MRI scan of the patient can be updated by physician on the patient profile. The interconnected cloud system between two or more medical institutions can also be accomplished by using the same method. This is also to study the previous case and find the new methodologies to save problems in the medical industries. Okay.
My name is Aaron and thank you Ruven for the presentation just now. Okay, now I'm going to present my slide, which is the challenge in implementation of cloud manufacturing. What are the challenges that have in the cloud manufacturing of this one Euris Medical in terms of the flexibility, the service data availability, the service of data reliability, the scalability, the system security, the data management, and the maintainability. Okay, so now in terms, I'm going to present the flexibility and the meaning. And flexibility is a service that employees should be adept enough to update or expand the infrastructure in response to the changing of need of healthcare providers. I mean, these standards are service quality in terms of operation, the audits, and the management. And the e-health service should be easily adaptable in order to meet this need with the least amount of work and expenses. And next is the service data availability. I mean, the medical data and services must be available to user all at all time. Cloud computing service are now experiencing a number of functional issues as a result of network failures, the hardware and software flaws, security breach, or natural catastrophes. As a result, the e-health provider must be address these issues and ensure that these services are always available with no downtime or performance deterioration. And for service data reliability is the e-health information, the system and service must be error-free, as they have a large effect on medicalization. As the number of cloud providers grows, so does the amount of anonymous data or services. And as a result, the e-health service should ensure that data availability independent of software, hardware or network failures. And in terms of scalability, one of the primary properties of cloud computing is the scalability. By means it enables users to scale up or decrease the amount and capacity of IT resource without interfering with their routine operation. And next will be system security. And because of the sensitive information that the e-health service deal with, such as medical data, security is the most crucial concern. It addresses challenges such as access control, audit control, authentication, authorization, transmission security, and storage security. When the data is kept in open environment, security problem arise because of private information may be exposed to unauthorized entity. Will be data management. As more healthcare organizations employ e-health service, the amount of data saved in them is rapidly expanding. Thus, furthermore, many files are copied to improve availability and dependability. As a result, the database language should be provide efficient and scalability data process and retrieval tools. And in terms of maintainability, the problem of maintainability is to deliver service to clients that are unaffected by any maintenance of the cloud infrastructure, service or platform. I mean, cloud resource and service must be created for simple and independent maintenance, and testing models must be developed to simplify the process and reduce the amount of time required. Okay, so in this, I'm going to present about the countermeasure and solution for the challenge. So, what are the challenge and countermeasure? They are improve the network process, develop evaluation process, strengthen preventive services, develop incentive and deterrence, and social networking, and Web 2.0 system focus on health issues. Okay, for countermeasure, we improve the network process, and means that innovation that cannot be restricted to a particular business or hospital network procedure, and network embedded knowledge is required to determine the system performance. And we develop evaluation process by means healthcare system require constantly developing metric and technique to evaluate system performance in at least 3 key areas, by means the cost management, public health and well-being, performance and customer satisfaction. And the third is strengthen preventive services such as good expenditure in preventative activity including education, promotion, schedule, screening, coaching and public health data gathering that may result in considerably better health system performance than in the same cash was committed to expose healthcare procedure. So this is the last two. Develop incentive and deterrence by means during the growth of healthcare system, the measure must be devised to encourage beneficial behavior and prevent negative ones such as corruption, neglect or waste in order to keep the rate of needless intervention under control. And the social networking and Web 2.0 system focus on health issue by means the web-based platform that connects specialized groups such as parents or children suffering from a certain ailment or professional working inside a specific national healthcare system. Okay, that's all for me. Now I'm going to pass my presentation to next presenter, which is Ruven. Thank you.
Alright. Thank you, Aaron, for the previous presentation. As for the conclusion, Euris Health Group companies provide Euris Health Cloud infrastructure at high speed. The main goal is to improve quality, safety, and efficiency of medical services to better engage with patients and families. Rather than that, it is also improve coordination of care and maintain the patient privacy and security. Lastly, the system enables collaboration with medical health institutions to make further research and development in medical industry. Alright, that's all from me. I pass to Mohammed Syazwan for the next part. Thank you.
Thank you, Ruben. Last but not least, the main reference of Euris Group is from the official website Euris Group. Connect the world with healthcare anytime, anywhere while protecting patients and enabling health. Next reference from journal The Cloud Paradigm Applied to eHealth from Jordi Vilplana 2013. And next reference from article and enterprise cloud-based electronic health record system from Adebayo 2014. That's all from us. Please take care and stay safe everyone.